Welcome to Coalition's Conversations, brought to you by the Greater Philadelphia Business Coalition on Health. My name is Tom Belmont, and I am the President and CEO of the Coalition and your host for these conversations, highlighting areas of innovation and opportunity for employers to focus on in building innovative and sustainable health benefit programs for their employees and their dependents. Today's installment is part of a series of 3 conversations, each focused on various aspects of obesity, weight loss, and GLP-1s. Through each of these conversations, we hope employers will emerge with information and ideas to build a sustainable program that integrates the best practices and aspects of promoting long-term healthy lifestyles for those dealing with obesity. This is a critical issue today as GLP-1s have become such an integral part of the conversation and treatment of obesity, as well as other disease states, and are viewed by some as that once-in-a-lifetime innovation that could bend the cost curve long-term. Reconciling the long-term potential to bend the cost curve with the financial challenges of today will take data and thoughtful planning to build a sustainable long-term approach. Today, we get an opportunity to hear the employer voice and speak with 2 leaders and long-term members of GPBCH, Marsha Greene-Jones from the City of Philadelphia and Dany Smith from the City of Wilmington. Both of these leaders have worked across their organizations to deploy strategies that integrate GLP-1s as part of addressing the long-term health impacts of obesity. We will take you through their respective journeys to engage the various stakeholders in their organizations and to build accountability into their programs, both from their members and their vendor partners. This will be truly an energetic conversation, so buckle up for some fun as we go on Coalition Conversation Unplugged with Marsha and Dany. So welcome.
Thank you.
Thank you.
Just to start off, Dany, you want to give a little bit of background on yourself?
Sure, thank you. Well, this is exciting. I am Dany Smith. I have been with the City of Wilmington since 2018 as the city's benefits director. This is actually my first time in benefits. I have a 20-something year career in HR, and really feel like I found like a true passion and love for HR once I came into the benefits space. So it's been a journey of learning, excitement to see how our employees and our workforce has grown. And it's also been a personal journey for me as well, as I feel like I found like my true level of health in a way that I hadn't even anticipated or imagined for myself. So it's been great.
And I know we'll share that story, so looking forward to that. And Marsha, I know this is kind of your first foray into the government world, so I want to talk a little bit about your background.
Okay, so I joined the City of Philadelphia in 2012, and I'm currently the Deputy Director of Human Resources responsible for health and welfare. And from a career perspective, I would have never thought that I would have had such a narrow role. I've been a VP of HR for several international companies. I've been an expat living abroad. So I've seen both sides of the spectrum in terms of what healthcare looks like in Europe and what healthcare looks like also in the private sector. So bringing those things together in my role at the City of Philadelphia has been an opportunity that I would have not expected at this point in my career. I've had over 30 years of HR experience, so this has been a very exciting journey for me personally.
It's fun. We keep learning, don't we?
Every day, yes.
Some good, some bad.
Yes.
So Dany, maybe start with you, since Marsha's frequently says, hey, I learned a lot from Dany and what she did at the City of Wilmington. Maybe start with, the program that you put in that was focused on weight loss and obesity.
Yeah, so we really got our start. I always like to say we were trying to actually build a culture of accountability, and we ended up building this culture of health. When I came into the city, we had, we just didn't have like a lot of accountability. People were showing up to the doctor for like pink eye and renal failure, right? It just like ran the gamut. So we had a set of benefits that we were actually already really proud of, but people were just kind of like not using or abusing it. And so when we were trying to sort of like right set the ship, we opted to really try to continue to not only expand our portfolio of benefits, but actually show people that they already had like really great stuff and here's how you use it. And that was really approaching a time where diabetes was really reaching a crisis state, and specifically in the state of Delaware. And as the largest city in the state, we really felt like we needed to be a part of that conversation because it was really representative of what our workforce was struggling with. So we really started focusing on diabetes prevention. Um, which a lot of people don't realize, like, I think there's kind of like this idea that like you just need to stop like having so much sugar, but it's really so much more than that. And that was like actually point one of education. And so that led us to not only wanting to help our employees eat better, but also move more. And that was the kind of led us into this idea of like weight management, lifestyle management, and things like that. And so it started with, um, you know, plan control, financial control, but also employee engagement and going from prevention into weight management, full on like lifestyle management is really, I think, how, was sort of like our trajectory there.
Awesome. And it's progressed over the years.
Yeah, yeah. So we've had some great success, managing, really sort of stemming the tide of diabetes. It used to be our number one chronic condition. It's actually gone down to number three or four. We used to spend easily, from a medical perspective, we used to spend $17.10 per person per month. And once we really started to focus not only on our plan design, but our programming and our pharmaceutical program, we've gotten that down to $7.10 per person per month. And so that's tremendous, right? On the flip side, right, we also, I've kind of mentioned these employees that were kind of just out here wild, doing whatever they wanted. And so, when I started the job, the first number that I ever heard was that only 26% of our workforce had even been to see a doctor in the last year. And by the time we, kind of did all of this great work, that number had reversed. 62% of our workforce was now seeing a primary care physician, which I don't think they even realized that you needed that center of the spoke kind of conversation to really understand where you were with your health. For many, that conversation started trying to look at not only their weight, but other chronic conditions, specifically diabetes. And then that was the jump start to really starting to say, like, these are the other specialists that I need. And so it's it's nice to be able to have this conversation and not have it just be anecdotal. Like, we have a great story or here or there, but we actually have like the financial numbers to really back that this work matters. It had purpose, but it also requires a level of consistency and staying the course is how I like to think about it.
And you bring a unique perspective because of your personal story, where that you have an instant credibility with folks once they hear your story.
Yeah, yeah. It's funny. I think this is really true of HR professionals. Like we know our stuff and we talk a good game and we really push and encourage people. Like like I feel like sort of like a mother hen to our employees, trying to get them to like do the right thing, make that phone call. Like we'll stop and even help people find a doctor, right? Like get on the phone, make that call, just get the appointment. And we're not really great about like taking our own advice because we just kind of get caught up in like doing the work, right?
Yes.
And so here I am, like we're making all these great strides, and from a personal perspective, like my health was actually decreasing. Um, Now there are a lot of other factors that kind of played into that. I became a new parent during COVID. COVID itself was just like this like monster thing that I think really impacted me. I mental health concerns, frankly, menopause, like all entered the chat at the same time. And so I just really wasn't using my benefits. Like I was like doing like the basic thing, like going to see my doctor. I was actually, but it started to really change when I started participating in the programs I was promoting, right? So I started by being a part of the diabetes prevention program. I always sit there, hey guys, I'm not sitting here as a city's benefits manager. I'm really sitting here as Dany because like I need this myself and it's a covered benefit and I'm going to try to benefit from our benefits. And I had a lot of life things happen. And so I lost weight, I gained weight, I lost weight, I gained weight. And where it really started to change is when I decided to, based on conversations with my medical providers, tried to, actually got on the GLP-1s and started it for the first time. And it's been quite a journey. So if we're going to share numbers here, I started off at 243 pounds and I got on the scale before I came here and it was 145.
Wow.
Yes, yes, it's been amazing. I never imagined that for myself. I never, it feels good to kind of like walk my talk, right? Because it's starting to get uncomfortable. Like I'm sitting here during open enrollment. I'm like, and you guys should definitely sign up for this. And I'm like, bloated and like sick and not feeling great all the time. And then how I live this life that I would not have imagined. And I'm so grateful. Um, for that experience of finally stopping and taking care of myself the same way I encourage our employees to take care of themselves. And it's just made a world of difference, not only physically, emotionally, for my relationships. I got on a swing the other day with my son, right? Like I never would have done that. We spent the entire summer in the pool. I promise you, I never would have done that. And it's just made me better. And I think it's made those conversations feel more honest as well, right? Like this actually does work. So whether it's diabetes prevention, that works. If it's going and seeing your primary care or specialist, including a mental health specialist, that works. But also there's these great medications out there. You kind of mentioned sort of these like once in a lifetime type of moments in healthcare that really sort of turn the dial and like move healthcare forward in a way that's actually permanent. That's where I feel like I am, and I'm proud that the city has offered it actually quite a while before this was like such a hot topic. It was just the right thing to do. It was a medication that worked that we added into our pharmacy program, and I hope to be a lifetime beneficiary of that, right?
And I think one of the things is, when we were at a prior seminar, you had talked about like, we talk about the impact on claims, right?
Yeah.
But you've actually seen it in your own claims that, where you've gone up, like,
Yeah.
the places you've had more services in, but the places where it's come down and, frankly, the number of hospitalizations that are down, things
Yeah.
like that.
Yeah. So like my benefits brain always comes in, and I think a lot of people think like benefits is this like, transactional thing. Like I don't want to say like we're financial wizards, but like we're doing some like serious math here to make all of these things work, right? And so that's actually like number one, I think, a part of our responsibility. And that's, juxtaposed with like we really want to see healthier and happier people, right? And so, when I think about what the average for the city of Wilmington anyway, but what the average employee spends on healthcare, right? It's like the 80-20% rule applies, right? So like your bigger claims are really for 20% of the population. And I certainly had gotten close to that. So, I failed to mention in the course of all of this time here at the city, I actually even lost a kidney, right? Um, so again, lots of medical reasons why this was the right thing. But so I always like to say that as an individual, like employee number, 10 on the profile, I was easily 25, $35,000 a year on the plan, right? So that's really different than that average employee that's doing like one visit, maybe one sick visit, right? Easily less than 1,000 per year. I'm already at 25, 30. I'm only 52 years old. I plan on being at the city for a while, right? So year over year, I'm like on that 20%, right? I'm on that cusp. I'm a specific cost year over year on the plan. Today, I go to see my primary care. I'm always going to need a nephrologist just because of that kidney. I have gone off, frankly, my depression medication because that was like a real thing for me. I am off of most of my blood pressure medications except for the ones that I'm always going to need for my kidney. I still take the GLP ones. Like I said, I feel like it's a lifelong support tool. And look, as the cost of that is coming down. So if I was 25, 30 year, 25 to 35,000 a year, I definitely think I'm still like a good, 2,500 to 5,000. And, again, year over year, that's significant decrease, right? So I'm one over 1,000 employees. We cover over 3,000 lives. You do that math, like there is a significant benefit to just being healthier,
Sure.
right? And it's just through one major change that I made that has really turned the dial, and also kind of, when you do the math, it has turned the dial for like our program. So, you know, um, I've used the numbers of like per person per month, but on a gross level, right, we saw a year where all of a sudden our claims came down $2.5 million compared to where they were just the year before. Again, consistency works, staying the course, but being steadfast in your belief that, plan design works, programming works, and pharmacy works, but you have to make them work together.
Right.
Yeah.
So that whole being healthy kick, like you've been such a big advocate at the city of, moving forward and trying to get GLP-1s or weight loss coverage in place. Maybe talk about the journey that you've been on, which is, sort of a tortured one at times.
Yes, actually, as you mentioned when we first started talking, is really meeting Dany and the program that they rolled out in Wilmington actually gave me the idea that I can do this too. Because I had been thinking about it since 2022, and then I met Dany, and I met people from her team. And one of the things I talked to them about was how it was working, what were the things that were difficult to overcome. And having met with them, then I decided that this is something that we want to consider. So in 2023, after having discussions with Dany and her team, I decided that I was going to formulate a weight loss program, and we call it the CAP Healthy Weight Program, city administered health plan for the city of Philadelphia. So that's why we call it the CAP program. So anyway, so we decided that I was going to work with our existing providers, because one of the things that I realized is that this is also about health literacy and people understanding the reasons why they were overweight and what are the things that actually they need to have support on. So working with our providers, I said, I'm not going to have another point solution. I was going to use our existing providers. And then I went to work with Active Health, who is our wellness provider. I went to work with Independence Blue Cross, who is our healthcare provider, and CVS, who is our PBM. So I brought all of them together in one meeting to discuss. And I asked them to bring their clinicians to that meeting to discuss what was on the table. And at that meeting, I presented my ideas about the CAP Healthy Weight Program. I solicited feedback from them in terms of how could it work. Because my first idea, and I kind of mapped out a program and said roles and responsibilities. This is the role of the provider. This is the role of the employee. This is the role of the employer. Of the employee, rather. So I wanted to kind of clearly articulate what those roles and responsibilities were. And so in doing so, I got some great feedback because I was very narrow in my scope. I was thinking, well, if they get the medication, they have to call in within a quick period of time. Mm-hmm. And the clinicians were very quick to point out, Marsha, life happens with people. So you need to allow people grace. So as a consequence of that, we rolled out a program that actually allowed employees within the first 4 weeks of picking up their medication, they have to make that first call to Active Health Management. And in that call, they're going to be talking with a coach and setting some goals for their actual health journey. And from that, our expectation is that our employees would actually have a call with a clinician for 26 weeks straight. And if employees missed 6 consecutive sessions, then we would disenroll them. Because we also realized that the importance of weight loss was about physical health, mental health, about their personal health in itself, nutrition, and also it was about their financial well-being and their families. And so we knew that commitment was important for people to make this journey, and we also knew it was about readiness. Were they ready? Were they able to take on this challenge? Because if they have a lot of things going on in life, perhaps this is not the right timing. So our program actually really has these requirements. If a person does not follow those requirements, we disenroll them. And at first, people are like, oh, you're disenrolling people? Yes, you are disenrolled. And we're very clear about the disenrollment piece and that it was about readiness. So that first year, oh my gosh, we were overwhelmed with phone calls, emails, spouses calling us, dependent children calling us, the employee. Well, I'm this, that. It does not matter. It's about equity also. Meeting people where they are, but also having the same standards for participation with every single employee. So, and their dependents. So we're talking about 12,000 covered lives. And so as a consequence of that, we were able to really, through time, because it didn't happen overnight, sure, people really understood that it was important to us to ensure that they got and understood. We wanted to work with them and through them and with their providers and with the coaches, because the critical piece was making that change. because we know for some folks, it may be a lifelong adventure. For others, it could be something that they just need for a short period of time. And so we understand that different strokes for different folks, but we wanted to ensure that employees understood what our expectations were. And with those disenrollments, our other part of the job was to educate them, to make them understand why they were disenrolled and what they need to do differently in future. And we're really draconian in this, and that when you were disenrolled, you could not enroll into the program until the next calendar year. And that's pretty harsh because people felt like, well, some programs, I talked to different folks all over, well, we disenroll them only for a quarter or whatever. But our thought process was, this is very expensive. We have a responsibility to our citizens who pay us. So therefore, we want people to be ready and to think about when they enroll in this program, it's because they want to make a change. And if you're disenrolled this year, guess what? You can sign up next year.
Right. I thought it was interesting, though. You talk about at some of the meetings, like so many people outsource everything.
Yes.
And you didn't outsource everything. You didn't, like, even some of the calls, I remember you saying you made them yourself, and had some pretty interesting interactions. Any of those you want to chat about?
Well, two things. The first thing was we didn't outsource the program because we had registered nurses as a part of our active health program who are actually clinicians who talk to the employees in coaching. But when employees called to complain that they were disenrolled, it was very interesting. So I had one lady who called and told me, well, you've disenrolled me. So I was, okay. So why don't you tell me a little bit about that? What happened? And so she's told me, well, for the last 2 years, I've been taking, had been taking Ozempic. Okay, and we know Ozempic's for diabetics. So I said, well, are you a diabetic? She said, no. I said, you're not a diabetic? I said, so why would you, well, I wanted to lose weight. My daughter wanted to lose weight. So she was disenrolled because we put an edit in place that unless you had a diagnosis of diabetes, you were no longer eligible to receive that medication. So fast forward, she had to now get into our program. And guess what? When the calls were made out, because our provider reaches out to the employee, she never answered the calls. And so I said, well, why didn't you answer the calls? Well, I just didn't think I needed to. So you're disenrolled. You can certainly join next year. Or I'll have people who called and said, I'm way too busy. My job is too important. All of our jobs are important, but we all have a responsibility to ensure about the readiness. So maybe this isn't a good time for you, but we'll work with you in terms of educating you to ensure that the next time you enroll, which is next year, you'll be ready for that challenge. And so the list goes on. And or I had another call. I'm the spouse of XYZ. I didn't know anything about the program. I said, well, you knew enough. So I said, oh, that's interesting. So how did you know to go get a prescription for the medication if you knew nothing about the program? Well, my doctor just wrote a script. So I said, your doctor just wrote a script for this medication. And we all know it doesn't work that way. Doctors, well, I thought my doctor was going to tell you, well, your doctor has so many patients. How is he going to know about the City of Philadelphia program? That's your responsibility. And so one of the things that we walked away with is education. People aren't reading the important information, but it's like whispering down the lane. Oh, they're covering this drug, so now you can go get it. But they're not talking about the consequences and what the requirements are, which we think are just as important as a person participating in the program.
And that's been a big part of your program as well, is the whole education piece. And you guys have really ramped it up, I know, with some of the, the annual outside event you have and everything else.
Yeah, I like to say, even myself, it was my first time in benefits. There was such an education for me to just even learn the language of PPOs and EPOs and things like that, right? It's a very confusing alphabet soup. And so I think our employees would sort of say, how was I to know, right? And so I think, when you're trying to engage people, that point of education happens, whether it's, let me just show you how to use what you have as existing benefits. I think that's a great call out in terms of your plan, right? You don't have to keep adding solutions. The solutions are there. Even for us, diabetes, the diabetes prevention program was a covered benefit since 2021 or 2019 or whatever it was, and we just didn't know we don't know how to use it, right? Like there is a disconnect, I think, between like the education piece, the communication, the how-tos of how to make, better health happen. And so that's what I think that program design comes in, whether it's here's like an end-to-end of how to use these GLP-1s, or here's how you sign up and the benefits of this step and that kind of thing. And it's just made a world of difference, but that engagement has to happen in order for that. And I think you made a great point too about whispers down the hall. Like, it's interesting to see how they start to support each other and share information so that everybody can benefit in the same way, especially when there's like a cost-effective way to do it.
Right.
They're kind of all over that. Is that free? Is that already covered? To what extent is it covered? And that, I think, really helps the word spread.
The other thing I'll add to that is, you're right, the educational piece, and that's with all things related to benefits.
Yeah.
We know that if we can manage our costs much better when people know better, right? Yeah. When they know better, they do better. And what we did was we set up a CAP wellness box for the CAP Healthy Weight program. So employees could email that particular box and say, I have a question. And then I would call, and the wellness provider, we would call folks and ask them what their question was, or we'd answer them. Then we said, oh, this is getting a little overwhelming. We created a form. In Microsoft Forms, we created a form that actually went through a list of about 20 questions that you can click on it, and it says, what is your question? And the person it says, oh, if you're asking about XYZ, it would answer that question. If you want to know why you were disenrolled, it would go through a litany of educating an individual on how the program actually worked. And once people start getting that, it got better. The other thing that I recognize is sometimes people learn better in groups. And so we have a huge program at the City of Philadelphia called a Lunch and Learn series. As of September, we had over 6,000 employees who voluntarily participated in Lunch and Learn seminars on a variety of topics about how to use their benefits. So those topics could be the CAP Healthy Weight program, managing diabetes, your eye exam, vision. We know diabetics and their vision, the importance of that. The other thing that so those are the things that we kind of dialogue about, and employees from all over the city can join in any of those lunch and learns. The other thing that I'm recognizing is that people want a quick fix. They want us to bring things to them. We recently had a eye clinic on site. It was phenomenal. I mean, the places went so quickly, and we realized that bringing things to people. So I think that's another opportunity. But just with the CAP Healthy Weight program, we learned, and we're continuing to evolve that actual learning with employees, understanding that they have some skin in the game too. Because it's not just us, we're providing the benefit. We have a responsibility to educate you, but you have some skin in that game too. Sure. And that's what employees aren't used to hearing from employers. We'll make it better. No. Yeah. This is too expensive. Right. And we want a long-term effect to help all of our employees and their families, because we know when employees are happy, healthy, their families are healthy and happy, and the communities as well. So, that's kind of the way I see it.
So, Marsha, one of the things, as you talk about education is, you had a lot of education to do to get the program in place with the unions, with leadership. So maybe talk about that, especially since this is such a big number potentially, and the benefits financially are maybe a little further out than this year's budget. So talk about how you educated kind of the rest of the stakeholders.
So one thing, our program is only for the non-represented employees. However, I'm a trustee with all the union health plans. So I sit on those health plans. So we discuss how they're managing their program with input on how I manage the City of Philadelphia program. But one of the things that happens in the city is when I put together a proposal with regard to what we want to do from a benefits perspective, that actually is presented to the CFO and his team every fall. And from that, the next step is to actually do a presentation for the mayor's cabinet. And so for me, it was about building trust with them. So I've been in this role for quite a number of years, and that trust is that when I roll out a new initiative, then they understand, and they ask lots of questions in terms of this because I had been wanting to do this for over a year. But the timing was not right. And it really was about ensuring that they understood what I was trying to do because we want to meet employees where they are. And we knew that this was something that you heard a lot of noise about, but until I met the city of the city of Wilmington, I didn't have the confidence to really go forward with it. And then the other piece that helped me was speaking to the two big manufacturers, Nova Nordis, I have to be honest, and Eli Lilly, because they were also good partners in this rollout as well. I can't diminish, especially Nova Nordis. I have to give them a plug for that. They were very instrumental. But anyway, at the end of the day, them having confidence and faith in me as I demonstrated the impact it would have on our employees, the programming itself, indicating that I was going to utilize our existing resources. I wasn't going to go out and buy another third party to manage this because we're already paying for our wellness provider who's supposed to be coaching our employees anyway. And so with that, they were like, okay, we'll give it a go. And, the other thing that was, so they supported me in this. The other thing that's really important is when anyone said, I'm going to the administration to report this program, I never had any pushback from the administration. They've supported me 110% because in the governmental space, it's about who you know. Yeah. I know this person to that person. People want to push back. The administration has been extremely supportive of us and said, this is the right way to do it. This is the way that we want to support. And all the unions actually are doing similar programs similar to what we're doing right now.
That's great. It goes back to the education piece you did with them and the trust you have with them.
Yeah, I think it's to be noted too, right? So when we got started with covering these anti-obesity medications, it was as we were setting up all of our programming, right? So I talk a lot about diabetes and things like that. So we started covering it in 2019 because we were looking at our plan design, our pharmacy plan, and making sure that worked well with the programming that we were offering. We, I think, had a softer start than what Marsha had to deal with, right? Because as Marsha was starting to build the business case, she was actually fighting the fact that these things had become trendy, right? And it had become trendy and noisy in a way that was like happy for individuals that wanted to get on it and like really scary for employers that like were scared to get on it, right? But probably it was the right thing to do. And so, I will say that, we don't have the same, protocols or requirements in place to do it, right? We do use prioritization. That's part of our pharmacy plan design. We continue to offer the same level of prevention programming and pushing that prevention programming is first. But I think as the tide has shifted to like GLP-1s just being center of the conversation, because again, like you mentioned Ozempic, like that was actually the start of it. Like these are diabetes medications that are actually really effective. And all anybody wants to talk about is the weight loss portion of it, which is also wildly effective, right? But like I've sat here and said, like, diabetes used to be our number one condition. It's fallen to number 3 or 4 because we actually have healthier people. Like these medications work, and all everybody wants to talk about is the weight loss portion of it. So I think like the evolution of the education is to make our employees aware that like, hey, we don't really want you to get on this because you want to lose 10 pounds for your wedding or for the summer or whatever, right? Like this is a lifestyle change, right? And with any medication, there's pros and cons, right? Like, some people, I was lucky I didn't have any side effects, but people have serious side effects. It's a trial and error to find the right GLP-1 that works for you. But I can't even imagine. And like, I think so much kudos to you, right? For again, like staying the course, fighting for what's right. It's not only the right like medication for your employees, but it's also like just the right thing to do for your plan, right? Like you actually have healthier outcomes and so many other things because of these things. But right, I think the evolution is continuing the education, continuing the plan design. Like you might find that if people are doing the right things, maybe there are different ways to execute the plan that you have in place. The city of Wilmington might have to look at it from a different perspective. We might need to put more guardrails in place right?
Right.
Because right, because we want to make sure the people who have the need are actually getting the plan, but also at the same time managing the fiscal impact of it.
And that is something we're hearing is, people that are now upping the BMI requirements and things like that to get to it. And the one thing I heard from your presentation there was just, hey, we were trendy, Marsha, before you were trendy. So,
She was, and she was, and I have to say, she gave me the confidence to go for it. Because without speaking to Dany and her team, I would have never taken that dive. And she gave me the confidence. Here was another city who probably has a similar population to the city of Philadelphia, because we also have to look at our populations.
Right.
Okay, so we were once the poorest city. We're the sixth largest city in the United States, and we are a melting pot of all different ethnicities. And so for us, it was about meeting people where they were, because some people told me, because I talked to some medical practitioners too, well, because we knew with bariatric surgery, they made people lose weight first. And then what I observed was people who lost the weight actually gained the weight 2 years later, because there was no support on the other end. And so my position was, if these folks could have lost weight, they would have done it already. So I'm going to meet people where they are, and I'm going to, if they meet the BMI requirements and they get the pre-authorization, we're going to provide that medication to them. Because I think we're not here to be the cops to say who gets it and who doesn't, just because you want it or you don't want it, know? And so I felt a tremendous responsibility, because I saw so many people on the other side of it. And so the challenge also was, no one's having bariatric surgery now, right? No one's having that. I haven't heard of, I mean, those numbers have gone down dramatically, right?
Absolutely.
And so this is a better alternative. It's not for everyone, but it's for those who'd like to take advantage of it.
So here's and this has been a great conversation, as I had every anticipation. We've been asking folks for their mic drop moment. So that one piece of advice that you would give to an employer who is, looking at adding GLP-1s and a weight loss program to their what they do for employees. What's that one piece you would give?
I don't know why that feels like such a hard question.
It is a hard question, actually.
I think I just err on the side of doing what's right. And so if it were a different conversation, if it were a different type of medication that treated or helped a different ailment, I just don't think we would be having this conversation, right? I think at the end of the day, people think that obesity is something that you've caused and done to yourself rather. It's like a will and not a need, right? And so I think this is a need, right? Obesity is truly a chronic condition. People get there multitudes of ways, and we just have the same obligation to treat obesity like we would high blood pressure or cancer or anything else, right? Fertility, that kind of thing. So I think do what's right for your employees. You have great people in place, I think, that want to do the right thing fiscally as well. And it's our job to figure out how to make all of that work, all those puzzle pieces come together. But intention is the right way, I think, to go.
And Marsha? You can say ditto.
Yeah, ditto. Ditto. Because I think at the end of the day, you're right, obesity is a chronic disease state. And I think people, I used to work with someone who felt that anyone who was overweight was lazy. And so that's a mindset of certain individuals, okay? And so as an employer, we have to know our population. And looking at your numbers and looking at the financials, claims information, you have a responsibility to hone in on the things that are going to make a difference in the lives of your employees, their families, and the community. Because when you do that, because it's all about caring for the people that you're supposed to be providing these benefits for. Yeah, we can provide all the benefits in the world, but if your employees don't feel as though you care about them and what they're trying to do in their lives, it improves. And we didn't even talk about this presenteeism and all the other things in terms of commitment to you as an employer. So it's about doing the right thing at the right time. And the timing isn't the same for every employer. It's not the same. And so employers have to think about what's right for them and when the timing is right. That's kind of the way I see it.
No better way to drop the mic. So thank you both for the conversation. So appreciated.
You're
And
welcome.
thanks for all the good work both of you are doing, because it
Thank
is
you.
the accountability you've built into both programs is
I love
amazing.
any time I get to talk to Marsha, so thank you for having me.
My pleasure. Talk to you.